Hi, hello all. Welcome to this today's session. In this video, we are going to see about the topic of hematinics. In this hematinics, there are several factors that determines the blood coagulations, such as platelets, and then clotting factors, and then fibrins. Each and every element which plays an important role in the coagulations. Today in this session, we are going to see about the topic of blood coagulations. Yeah. So this type of blood coagulations, there are majorly three drugs, such as the drugs acting on the platelets, and drug acting on the coagulation factors, and drug acting on the fibrins. So the drugs acting on the platelets is further classified into two types. So you can see here the drugs acting on the platelet, it is further classified into two types, such as pro-platelet drugs and then anti-platelet drugs. So this pro-platelet drugs means which enhances the activity of platelets, whereas this anti-platelet drugs which decreases or antagonizes the actions of these platelets. So this plays an important role in the blood coagulations. Moving on to the second one, the drugs acting on the coagulation is the form of agglomeration of the platelets. So when the platelets gets near the tissue damage, it forms the blood bleeding stoppage. So this drugs classified into the procoagulant and the anticoagulants. So certain drugs which are used as a coagulant. For example, in heart patients, if the patient has the thrombosis or blood coagulation in the blood vessels, we can give the drugs which acting on the coagulations, because this procoagulant which further enhances the coagulations in the tissue damage and stop the bleedings. For if a patient is a severe heart patient, such as thrombosis he have, so in that condition we have to break the coagulations of the blood vessels in order to free down the passage of blood vessels. Yeah, we are giving and the anticoagulant drugs. So on the third category is the drug. These fibrin molecules are that which combines command for the platelets, which attach firmly in the tissue damaged sites. So further increase, for example, if there is a tissue damage in your cells, suddenly platelet comes into the target sites and forms agglomeration or coagulations. So around that, the fibrin molecules hold this platelet firmly. So further prevents the leakage of blood. So in certain cases, if the platelet accumulated at the tissue sites is higher, it can form as the agglomeration or the thrombosis at the target sites. So it will narrow down the blood vessels, it increases the blood pressures, and decreases the blood flow from one side to another side. So in that criteria, we are giving as a antifibrinolytic. This antifibrinolytic that lyses the fibrin molecules around the tissue target sites, further enhances the blood vessels freely from the blood vessels. And fibrinolytics, this fibrinolytic lyses the fibrin molecules which further break down the fibrin and free down the passage, whereas in the antifibrinolytic which inhibit the enzyme that are responsible for the fibrins. So we are moving on to the next slide. Physiology of the blood in the body. So consider a blood vessels. This yellow color region is the blood vessels. We have that red color blood cells, and we have the endothelial cells here. So every blood vessels has the endothelial cells. So blood vessels is normally moving around the blood vessels. So beneath the blood vessels we have the collagen molecules. So these collagen molecules primarily used for the blood coagulations. So consider this as the blood, and here we have platelets are in the WBC, and then fibrin molecules that are circulated in the blood vessels. So in certain instance, so in certain instance, if trauma is occurred, so remember, if trauma is occurred, so in certain images, for in certain instances, if trauma occurred, there is leakage of the blood vessels. So here we have the tissue injury. So here the blood vessels are moving into the tissue damaged sites. So in these certain cases, the platelets that are flowing through the blood vessels came in contact with the tissue targeted sites. Here we have the collagens. So this platelets that are moving into the target sites. So at the same time, that endothelial cells which liberate some factors known as van Willebrand factors. So these factors also came into the target sites. Consider these platelets. So we are taking one of the platelet molecule here. So this is the platelet. Consider this is a platelet molecule. It has several receptor on it. So in order to bind with the specific target sites. So first one is the GP1A receptor. So this GP1A receptor for particularly bind to this collagen area. So here we have seen the collagen area. Receptor of the platelets binds to the collagen molecules, whereas also contains another receptor called GP1B. Here we have seen GP1A and here we have seen GP1B. So this GP1B binds to the van Willebrand factors that are released during the tissue injury by the endothelial cells. So we have four receptors. One is the GP1A and second one is the GP1B and third one is the P2Y12 receptors. This P2Y12 receptor we have further discussed in this video. We can see at later. And the fourth receptor is the GP2B and 3A. So this receptor is responsible for the firm attachment with the another. So consider this is the platelet molecule. So here we have platelet aggregated at the tissue injury site. So tissue injury site, these platelets are aggregated. So this forms the temporary only. So in order to make it permanent, we have linked with the fibrin molecules. In order to make it fibrin with the molecules, so we have attached with the this platelet molecule as a GP2B or 3A receptor for attachment with the fibrin molecules. So moving on to the next one. So in order to stop bleeding, so we have met with an injury, tissue trauma. So in order to stop the bleeding, first came into the action is the so this platelet forms temporary plug in the so this platelet forms the temporary plug and stop the bleeding. So consider if the minute blood vessels are damaged. So in that particular area, the platelet come into the first line of actions. So that forms the temporary plug. அது என்னன்னா ஒரு plug மாதிரி வந்து அந்த இடத்துல வந்து ஆக்ட் ஆகும். ஸோ ப்ளீடிங் வந்து என்ன ஆகுனா அந்த எதை பொறுத்து இருக்குன்னா நம்பர் ஆஃப் platelet molecule that come in contact with the tissue injured area. So if the number of platelets at the tissue injured area increases, the bleeding will be decreases. So vice versa it will occurs. So this forms the temporary plug. In order to completely block the tissue damaged site by bleeding, so we need to convert into the permanent plug. So we need to convert these temporary plug into the permanent plug. So for that, the second element into the action is the fibrin. This is fibrin act as a cement. So here we see that these are the platelet molecules that are considered as a bricks. So in between the bricks there is no cement, it forms leaky or which forms weak. So in order to make the construction strong, we have to other addition substances such as cement between the bricks. So it forms permanent stronger to the building. So here the second molecule come is the fibrin that acts as a cement that fills in the gap of the these fibrin molecules. So this forms a permanent plug and this forms the permanent plug and leads to the cross linking of the platelets. See here we have the platelets, different platelets that are found by the temporary plug. So for this platelet has the different receptors. One is the GP1A receptor, another one is the GP2B receptor, another one is the P2Y12 receptors, another one is the GP3A that receptors. This contains the four receptors. So this fibrin molecule has the already I said these few molecules that has the receptor known as GP2B3A receptor for the attachment with the fibrin molecules. So you are seeing no, this is a fibrin molecule which is attached to the particular receptor of the platelet such as GP2B3A. This cannot rupture easily. So this temporary plug can be easily ruptured and may cause further bleeding. But if in case fibrin attached to the platelets, it forms the permanent plug. That means it cannot rupture easily. Moving on to the next one. So here we have fibrin molecule in the platelet for cross linking. So this fibrin molecule we do not have in our blood. So body does not have contain fibrin, but rather it contains the fibrinogens. So that is, it is inactive forms. These fibrinogens that are normally flow in the blood vessels, that is inactive forms. In order to convert this inactive form into the fibrin molecules, that is active molecule, it forms film with the platelets and forms the permanent plug and causes does not rupture easily. So we have to, the first step is fibrinogens we want to convert into the fibrin. So it further stops the bleeding. So here we have the blood vessels and the blood platelets, and we have the blood, and we have the fibrin molecules also. Here we have the collagens. So when the tissue trauma occurred, okay, there is two pathways. One is the extrinsic pathway and one is the intrinsic pathway. So this extrinsic pathway occurs when endothelial injury is occurs. So if there is endothelial injury, this extrinsic pathway takes place, such as collagen and van Willebrand factors may be released, and this collagen and van Willebrand factors is also known as the tissue factor. Can you remember what is the receptor that is responsible for the van Willebrand factor to attachment with the platelet? Comment your answers. So this tissue factor further activates the tissue factor 7. This factor 7 further activates the factor 3, and factor 3 activates the factor 10. So another case also, there is intrinsic pathway of the blood coagulations. So in this intrinsic pathway can occurs when negatively charged particles activate the fibrin molecules. So this further activates the factor 12. So this negatively charged particle activates the factor 12, and it further activates the cascade the effects to the 11, and this factor 11 activates the 9 and sequentially 8. So this factor ultimately results in the activation of factor 10. So can you remember how many clotting factors are there? So comment your answers. So moving, so further we are ended with the both intrinsic and extrinsic factor with the activation of factor 10. This factor 10 activates the prothrombin to the thrombin conversions. This thrombin is known as the factor 2 of the coagulation factors. This factor further activate the fibrinogens. This fibrinogen is the inactive form in the form that circulate in our blood, which converts into the fibrin molecules. This fibrin molecule is responsible for the adherence of the platelet at firmly to the tissue target area injured at